The city of Lagos is a major gateway of Nigeria to the world and the world's gateway to Nigeria. Your Lagos, my Lagos, our Lagos is indeed the economic powerhouse of Nigeria, a global city brand of repute and choice. Welcome to our Lagos. Welcome to the City of Lagos TV show. Let's talk Lagos.
Go Lagos!
Actualizing the goals and aspirations of his government's developmental agenda, the Lagos State Governor, Mr. Babajide Sanwo-Olu, has kept up the pace to deliver on his campaign promises in key sectors of the economy. This is evident in recent official engagements of Mr. Governor. So let's put you on speed from the Governor's Office platform on the City of Lagos TV show on TV Nigeria. We'll be right back. The Lagos State Governor, Mr. Babajide Sanwo-Olu, took time out to take up an inspection tour of the Ojo General Hospital project under construction to ascertain the level of progress so far. After an extensive and thorough inspection tour of the project with key cabinet members and representatives of the contracting firm, Mr. Governor gave a vivid physical description, potentials, and quality facilities of the project, having all the trappings of a specialist hospital, as well as appreciating the efforts of the contracting firm for doing a good job.
The massive infrastructure and the facility that is coming up at these premises is over 6 hectares of land. It has full outpatient complement of all forms of medical diagnostics, accident and emergency, everything you can imagine in a specialist hospital will be here. And on top of that, it's got 280 bed accommodation. It's been built on what we call on 4 different verticals, right? And you see the walk around that it's not only extensive, it's actually very massive. But beyond that is to say it also has auxiliary facilities, which includes, so we believe that this will be an end-to-end complex. There will be a place where people can work, can live, and patients can come in here, receive medical care, and get well when they're leaving. So our word here is to encourage our contractor, Mr. Siba Construction, who we believe is doing a very big task here, and we've encouraged him that whatever is our own part, we will fulfill our own obligation, and we're hoping that before the end of this year, because that's the problem. This is January, and we're starting back bright and early. Before the end of this year, the man should begin to hand over our keys to us, but we will push everything to ensure that this becomes active. So there's a lot of improvement that were brought to this neighborhood. You could see the flyover bridge. You could see it's right in front of the blue line, which will be terminating at Okokomaiko. This will be the Iba Junction. And so you can see that there's a complete renewal of life, in all of these places. And so to have this multi-specialist general hospital also being stationed here, it means that indeed government is working for the people of Ojo, for the people of the entire Badagry division and their Awori land in general. And we just want them to continue to encourage us, to continue to wish us well. And let's hope that in another 12 months, we'll all come here, and push SIBA and ensure that we'll come and hand over this facility to the citizens and to the people of Lagos West Senatorial District.
The Lagos State Governor, Mr. Babajide Sanwo-Olu, alongside key cabinet members, representatives of the contracting firm, and traditional rulers, conducted a groundbreaking ceremony of Platinum Shopping Complex project in Ojo. Mr. Governor, in a short presentation, spoke on the benefits, advantages, and infrastructural value the shopping complex project will bring and have on the ongoing regeneration of the Ojo community.
An attempt for us to do what we call regeneration again. As you can see behind you, that's where we were couple of minutes ago. That's the Ojo Specialist General Hospital. Behind us here is another stakeholder, the military. And in here, there's a plan for a multi-use shopping complex. Right in front is a university. So all around here, we're regenerating and we're repurposing so that we can improve not only the transportation infrastructure where you have the rail line there, but also the physical infrastructure. There's a lot of BRT improvement by Iba Junction that we're doing. And we have a lot of markets on the road, a lot of people selling on the road. This is an attempt to bring them into a more formal means where the key clams will be available for them and the shops will be available, food courts. So let Ojo people, let them also live well. Kabesi, let them live well like other parts of the city and see real development. Hospital is here, rail is here, market is here, school is here. It's all a change and improvement of your lifestyle. And we believe that all of those things improve the social economic power of your people and of our citizens in this corridor. We will ensure that the contractor does not come and unless they don't bring with prices that will be heartbreaking. I will personally supervise that it is something that is affordable and is accessible for the citizens and the dwellers of this community. Will make you the priority. You are hearing me? So that's the only way where I'm here. And it has to finish it before the end of this administration. That's the condition for us to come and commission it before the end of our administration. So we've got only 18 months to complete all of this. Thank you very much.
The Lagos State Governor, Mr. Babajide Sanwo-Olu, recently officially commissioned 4 different roads, totaling 10.10 kilometers in Oriade and Muwo-Odofin local government area, as a proof of his government's commitment to providing sustainable and resilient road infrastructure in Lagos State. In his speech, the governor articulated the infrastructural potentials of each of the road projects, assuring the people of their positive impact and benefits to socio-economic progress of the area.
These are 4 strategic roads that we've seen have changed and is changing the face of social economic development in Oriade, in Amuwo, and extending also to Ojo. We're bringing everything together. The first one is the Irede Road, which you know we have completed up to the Irede Jetty. That jetty, we're doing something so that you can cross onto our riverine area. That has been completed. The second one is Adiomumuni Badmus, 3-point-something kilometer, all the way to the jetty as well. Ijegun Jetty, very strategic for petroleum products and all of the PMS that is coming into the hinterland. We know what the destruction had been. The third one is the old Navy Road, Navy Town Road. Navy Town has the strategic, from the name, Navy Town Barracks. Our men of the Nigerian Navy that continue to implement strategic security on the waterways for us. We want to say to you that our development cuts across every arm of governance, be it military, be it private, be it public. Will ensure that no one is left behind. The fourth one is the famous Old Ojo Road. That is a long stretch all the way that gets into Trade Fair, from Maza all the way there. Because of the strategic importance of it, we have to break that into 2 phases. We will start the construction of the phase 2 of the road so that we will not give you half bread. We will give you a complete 3-course meal, because that is what you deserve.
And finally, from the governor's office, Governor Babajide Sanwo-Olu received in audience the ambassador of France to Nigeria, Ambassador Marc Forbosta, alongside other French diplomats on a courtesy visit to Mr. Governor. The governor, in his brief remark, promised that his administration will continuously partner with France in agriculture, public transportation, and other areas of interest that will be of mutual benefits to both parties. Speaking earlier, Ambassador Marc for Bolster noted that his visit to Lagos is to sustain what is on track in terms of deepening the relationship between Lagos and France, as well as launching more ambitious projects because of their belief in Lagos State. And that's the package. We will keep you posted on recent engagements of the number one citizen of Lagos State, Governor Babajide Sanwo-Olu, in our subsequent broadcast on the City of Lagos TV show on TV Nigeria. Next is Lagos Agencies in Focus platform on the show. Please stay tuned.
Go Lagos.
You're still watching the City of Lagos TV show on TV Nigeria. Welcome to Health Lagos. This is one very strategic and informative platform where we, of course, inform and educate Lagosians and various stakeholders in the Lagos State health sector. Health is one of the very vital pillar of the Teams Plus agenda. But there is also a very critical agency that is saddled with the responsibility of ensuring that health institutions, practitioners are well regulated and well supervised. That very strategic agency is the Lagos State Health Facilities Monitoring and Accreditation Agency, FEMA. And of course, the whole essence is to find out and verify the level of efforts, initiatives, and achievements of the agency in fulfilling its core vision, mandate, and of course, values. It's my pleasure to welcome the Executive Secretary of FEMA, Dr. Abiola Idowu. Madam, thank you very much for coming on the program.
Thank you for inviting me.
It's
Good
a
morning.
pleasure.
Yeah.
Let's start from your core mandate, vision, and mission statement of the agency.
Facilities Monitoring and Accreditation Agency was established by the Health Sector Reform Law of 2006. At that time, there was a gradual decline in the general state of health and the quality of care. And there was a lot of infiltration of quacks. So the agency was set up to improve the quality of care by setting standards for the practice of all health facilities and then ensuring that these health facilities comply with the standards that have been set through monitoring and inspection and consequently accreditation of these facilities. Our core mandate is that we visit each facility for monitoring at least twice in a year. Our vision is to be the foremost reputable agency in West Africa. And our mission is to ensure that all health facilities are providing safe care to the citizens of Lagos State.
Thank you very much. Now, Executive Secretary, what are the required minimum standards for the operation of public and private health facilities in Lagos State, as well as accreditation, inspection, monitoring, and licensing of health facilities?
Basic licensure. For example, hospitals, we have clinics, laboratories, diagnostic centers, cosmetic surgery clinics, a whole lot of them. So all the standards in terms of the number of healthcare personnel that they must have, the ambience and the way the health facility is supposed to, be laid out, the processes in the hospital, everything is in the standards. So for example, if it is a hospital, for example, since the person in charge will be a doctor, the doctor must be a fit and proper person. There must be at least a matron in charge. They must have at least a minimum of 3 registered nurses. I'm just giving you an example of the standard of the hospital. And then they must have all the requirements from government that, all the appropriate requirements. For example, they must be approved. Their building must be approved by government. They must have approval in terms of, for example, their fire equipment. They must have approval from LOMA, that LOMA will be picking up their medical waste. Every approval that is relevant. And then the layout of the facility must be such that it is conducive for providing safe health care. We verify this with the aid of tools. We have tools to say, okay, you have this, you have that, you have this. And at the end of the day, when we are satisfied with state of the facility, we issue a certificate of registration.
Like you said earlier, there are quacks and there are efforts by your agency to check that as well. So what is the monitoring mechanism to ensure that these health institutions, either private or public, are actually adhering strictly to your expectations?
By law, every health facility must register with the agency. Section 60 of the Health Sector Reform Law says that. And the process of registration is you put your documentation online. We have a registration platform called ePharma where you put up all your documentation, you upload your documentation. When your documentation is satisfactory, we set out to go out for inspection. And if the facility is approved, we issue a certificate of registration, like I mentioned earlier before. We also carry out monitoring of all health facilities. So if the facility is registered, our mandate is that we'll visit it at least twice a year to ensure that they are complying with the standards that we registered them for. If a facility is not registered, it means the facility is illegal and they don't have any business operating. So facilities like that, we often shut them down. But if the facility is okay, satisfactory, then we set out and encourage, if you want to continue to practice, you need to register.
Madam, let's look at very significant achievements, efforts and initiatives of EFEMA under your leadership and of course in a larger picture under the Governor Babajide Sanwo-Olu administration.
In the last 4 or 5 years, the agency has made remarkable achievements under the leadership of Mr. Governor, Mr. Babajide Sanwo-Olu. First and foremost, we were able to set up fully as an agency, and then we were equipped with monitoring vehicles so that our monitoring increased significantly, as much as 50%. And then Mr. Governor approved that we also outsource our monitoring activities to franchisees. They are reputable organizations who carry out the monitoring activities for us so that we're able to meet our mandate of ensuring that we visit registered facilities at least twice in a year. In the past, for example, I inherited over 500 facilities that had applied for registration that they couldn't go out to visit these facilities because of constraints of the fueling. So we were able to clear all that. That was a remarkable achievement. Within the last few years, we have registered not less than 2,000 health facilities. Recently, we have also developed what we call QR codes for health facilities so that the general public can give us feedback. So by February this year, we're going to be distributing these QR codes to all registered health facilities to ensure that general public can easily give us information. If they go to a facility and they are displeased or they feel that they have interacted or been treated by quack or persons that are not qualified to give service, they can quickly, let the agency know that this is what has occurred. And then, of course, the ease of doing business, where providers are now able to interact with the agency through the electronic means. They can register and renew their processes even without coming to our office. We were very relevant during COVID. All the laboratories that carried out the COVID tests, the agency was the one that inspected and gave them approvals. Then we have also started the accreditation process, that is a recognition, international recognition now as an agency, even though the law has conferred on us the ability to, give accreditation to facilities. We also want to be recognized internationally so that we can, if we so desire, carry out our accreditation to West Africa. It's quite important to say that apart from all the critical achievements that I had mentioned, that no other state in Nigeria has a full-fledged agency for monitoring and accreditation. And all the other states that are coming on, at least 13 states, came to understudy the agency so that they can also establish their own accreditation agency. And I'm also aware that the federal government is trying to is trying to establish something like a farmer so that every state of the federation also has an accreditation agency.
An agency of this nature, you are more like a policing organization for private and health institutions. It is very critical to also ascertain how well trained is your workforce, talking about your human capacity building within the team. So how would you appraise the level of workforce you have in trying to make sure that you're able to operate at expected standard?
As an agency, we have different cadre of staff, from the administrative to the finance, the procurement, and then of course we have the core staff. So last year, for example, every member of staff from the senior category were trained in their core areas. And then outside of that, staff that are actually, delivering the services for our core mandates were also trained. Some are trained as quality assessors, but everybody was trained on quality improvement.
Would it be right to say that FEMA has actually aligned itself with the Teams Plus agenda of Mr. Governor?
Certainly, because we know that health is a key component of the Teams Plus agenda. The World Health Organization, for example, said that as much as 40% of the care that is given is wasted because of poor quality. Yeah, so if we can assure that the quality of care we're giving is optimal, one, you would encourage people to visit health facilities, and two, you would reduce wastage.
When you have reliable, verifiable data, it makes your job easy. So give us a reliable statistical data of private and public health facilities under your watch. And how have you successfully carried out, of course, the inspection, supervision, and evaluation to meet up standard?
The agency has registered about 5,376 health facilities, but it is not all these facilities that were registered that are currently on our register, because we assume that only facilities that have renewed their registration that are registered. So as we speak, we have only 1,926 health facilities that are in good standing. But I'm sure that as the year is progressing, we would have more that are in good standing. You have to be in good standing before we can actually say you are registered. But we have registered, so there are two different things. So for the monitoring, they were able to visit all the facilities that were registered, about 30%, 994 twice. In year 2023, they visited 83% registered health facilities, at least twice. Then last year, there was a dip. And I think it was understandable because of the pressure of the economy and the current realities. The monitoring went down to 57%. But that is still an improvement from what we used to have when we were only working as the agency to carry out monitoring.
Of course, the Ministry of Health is your parent ministry, but there is also the possibility of synergy and collaboration with other MDAs to deliver on your mandate. So which of these MDAs do you collaborate with?
I mentioned that they have to get all relevant approvals. So, for example, you want to register a health facility, whatever type of health facility, you have to have at least the proprietor or the operating officer, the person in charge, must be registered with LASRA. And then, for example, you want to register an ambulance service, you have to register with Ministry of Transport to ensure that that ambulance will not be breaking down, it's viable. We work with LOMA because LOMA would remove the both medical and domestic waste. They must get certification from LOMA. Then we work closely with the Board of Traditional Medicine. We do co-regulation, and then we do joint monitoring. If you need to get any approval from government, we ensure that you get it before we give you certification.
What are the critical areas of challenges for FEMA?
The critical areas really, staffing. We still need more assessors. We need quality assessors, those who are grounded in quality, who can actually carry out inspections and monitoring. Because when you carry out inspection and monitoring, you apply it too. But then you also need to let the facility know that these are the areas where you have infractions and this is what we want you to do. Of course, we need more vehicles for hard-to-reach areas.
A lot of people want to make inquiries on what they need to do. So what are your social media platforms? And if there are hotlines they can reach FEMA on, maybe you can tell us.
Thank you very much. Okay, so I will first of all say that we at FEMA, we recognize our stakeholders. However, recognizing that the general public was a critical stakeholder, it took us a while. And it is one of the things that we're focusing on in 2025. That is one of the things that informed the development of the QR codes, so that they can interact with us more easily. But then we also have social media handles. Facebook, it's at FEMA. Twitter, it's at FEMA_LASG. The LinkedIn at FEMA. Instagram at FEMA 2020. And we have email addresses, efama@lagosstate.gov.ng or efamamail@gmail.com. We want people to interact with us very freely.
Does the FEMA hold occasional stakeholders meeting? Because as a monitoring agency and supervisory agency, there is need for periodical stakeholders, seminars, workshops, where you are able to educate these operators. Do you have such?
We meet with our stakeholders on a quarterly basis. If any new thing is coming up, we let the stakeholders know. So, for example, the professional associations and the facility operators and the professional bodies, because they're also stakeholders. For example, the Nursing and Midwifery Council of Nigeria, the Radiographers Board they are stakeholders. We have a very good working relationship with them. The Medical and Dental Council of Nigeria. We also carry out educative seminars for the providers. In recent times, what we do is we also carry out town hall meetings at all the local government areas, and we carry out sensitization and awareness, letting them know. And what we do is we carry our logo to say, if you do not see this logo in a health facility, don't visit. In recent times, we invite the other regulators, for example, the police, so that they are aware of our activities. And they are aware that some facilities that are not recognized are those that do not have logos. If they have any information, they come to us. And it has been working.
Dr. Abiola Idowu, the Executive Secretary of the Lagos State Health Facility Monitoring and Accreditation Agency. It's been quite expository, letting us to know the very major significant efforts and initiatives by the agency in order to live up to its core mandate, vision, and mission statement. What are the future progressive plans for the agency for Lagosians?
The immediate one, registered health facilities would have QR codes that the citizens can interact with. If they have complaints, that is the immediate. And then in the future, we're hoping that you'll just pick up your smartphone, Google health facilities, their location, like health facilities near me. Google their location, and once you Google their location, their services that they render will come up. So, and it would only be facilities that are recognized by government.
How do you want to describe Governor Babajide Sanwo-Olu's support for the agency?
Mr. Governor, Mr. Babajide Sanwo-Olu has been very supportive. If you recall, I mentioned earlier that it was during his first tenure that the agency became fully established and were given more staff. He approved the outsourcing of our monitoring activities to reputable organizations. We're giving monitoring vehicles. We're giving 5. Those are, critical achievements.
On a final note, any word of encouragement, assurance to all stakeholders, partners, and Lagosians in general?
For our stakeholders, the public, we want to encourage you that if you see something, you say something. And if you say something, we will do something. That is the assurance that we're giving you, that the government of Mr. Governor Babajide Sanwo-Olu, it wants to give you assurance on the quality of care that you get in all health facilities. The only way we can do something is if you come up to us and tell us what you have seen, and we'll do something if you reach out to us on our social media handles at @efama or at @efama_LASG, email at lagosstate.gov.ng or efamamail@gmail.com, or on our numbers 090-156-37023, 090-5727-3396. And then for the healthcare providers, we want to encourage you to continue to comply with the standards that have been set.
Dr. Oyedepo, who of course happens to be the Executive Secretary. It's been quite interesting ascertaining the level of achievements and positive impact being made by the agency to deliver on its core mandate, vision, and mission statement. And of course, when it has to do with quality healthcare delivery, I want to believe that EFEMA has a better and a good deal for Lagosians. The City of Lagos TV show will continue in a moment, right after this time out. Stay tuned.
Go Lagos!
Hello, Lagosians. I am Abiola Idowu, the Executive Secretary of Lagos State Health Facilities Monitoring and Accreditation Agency. Health is a key component of the Themes Plus agenda of Mr. Babajide Sanwo-Olu, Governor of Lagos State. And in line with this agenda, the Health Facilities Monitoring and Accreditation Agency is placed to ensure that all health facilities provide safe and quality health care to the citizens of Lagos State. In terms of supervising health facilities or monitoring them and ensuring that they provide safe and quality health care to the citizens of Lagos State, the Health Facilities Monitoring and Accreditation Agency has the capacity to ensure this and affirm on our mandate. Do you want to register your health facility? Visit us on our website or any of our social media handles that is being displayed on the screen. Are you a registered healthcare provider? Have you done your renewal this year? Visit our website, access the registration portal, and do the needful. And the general public, do you have any complaints after you have visited a healthcare facility? Visit us at any of our social media handles that has been displayed on the screen. We are interested in ensuring that you access good, safe, quality healthcare services at any of our health facilities in Lagos. And that if you have any complaints, that we would attend to the complaints and investigate accordingly. So for us in EFAMA, if you see something, please say something, we will do something. Reach out to us on our social media handles on the screen. Ìgbéga ìpínlẹ̀ Èkó, àjùmọ̀ṣe ni.
On the City of Lagos TV show every week, we pride ourselves in projecting the choice city, Lagos, from diverse perspectives. Know more about this great city next week on the show on TV Nigeria. Thanks for watching.